Hey guys, welcome back for another week of Topics and Tips Tuesday. This week we are discussing Weber versus Rinne. Rinne? Rhine? I hear it so many different ways, but you know the exams that I'm talking about. We utilize this assessment tool to assess patients who have hearing loss. So if a patient comes into your office complaining of hearing loss in their right or left ear, you're going to want to do these two exams using your tuning fork to assess and see if it's conductive hearing loss versus sensory neural, okay? So let's talk about it. So with the Weber exam, with Brittany's brilliance, I always think of crazy things to make me remember and help my review students remember as well. So when I think about Weber starting with a W, I think of the shrugging shoulder emoji. It's like, so to me, it makes the shape of a W, right? So the center, the middle point of the W, I think of as striking the tuning fork on your forehead. So, you hit the tuning fork, place it on their forehead, and then you ask them, which ear does the sound lateralize to, right? Which ear does it lateralize to? It should not lateralize to either ear. The patient should tell you it doesn't. I hear it equally in both ears. That's a normal finding. If they say it lateralizes to a particular ear, now you need to break it down to, if this is one of your patients who have complained of a hearing loss, you want to hear them tell you one or two things. So say if they came in saying that, hey, I haven't been able to hear as well out of my right ear. So we're going to say the right ear is the affected ear on this patient that we're discussing, right? So if the sound lateralizes on your Weber exam to the affected ear, then that's conductive hearing loss. But if the sound lateralizes to the unaffected ear, which would be the left ear in this case, that is considered sensory neural hearing loss. Different things fall in that category. We'll talk about that another day. I just want to break down the basics on this, okay? So with conductive hearing loss, one cool trick that I always like to talk about, because I learned this when I did Barclay's review when I was an MP student and getting prepared for boards. I did all the reviews, y'all, but another story for another day. Barclay tells you this trick, and I think it's amazing. So if you place your finger in your ear, so we said the right ear is the affected, right? Place your finger in your ear, say anything, and watch where the sound lateralizes. So hit a note, do something, la 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 la, whatever you're gonna do something and say it and tell me where it lateralizes. It works, doesn't it? So the crazy thing is, when you think about conductive hearing loss, that means like something is there blocking that air conduction, a sound wave conduction, right? So like if a kid put a marble in their ear, if there's a lot of cerumen in the patient's ear, whatever the case may be, that's your conductive hearing loss. So always remember that if it lateralizes to the affected ear, it's conductive hearing loss. If it lateralizes to the unaffected ear, then it's sensory neural, right? Okay. Now, let's go on to the Rinne test. So with the Rinne test, it's a little bit different, but the same concept. This is testing more for the conduction. So air conduction versus bone conduction. You will commonly see this as AC versus BC. The normal findings, AC should be greater than BC by a 2-to-1 ratio. So AC, your air conduction, should be greater than your bone conduction. So we're going to do again, this is my fake tuning fork. You're going to hit your tuning fork, first placing it on the mastoid bone, because that's your bone conduction. So once they do that, it's letting you know. So you say, hey, let me know when you no longer can hear the sound. When they say, okay, I no longer can hear it, then you place the tuning fork in front of the ear. This is now your air conduction, because this is air waves. So that air conduction should be greater than the bone conduction. So they should still hear sound after the bone conduction has stopped. Now, if they don't, then it's an abnormal finding, right? So if AC is greater than BC, they will still hear it when you place it in front of the ear for air. So AC conduction, you're going to hear because it should be greater than BC, right? Bone conduction. So again, tuning fork on the mastoid bone, tell them that to let you know when they no longer can hear the sound, right? All right. Now they can't hear it anymore. Place it in front of the ear for air conduction. Then that lets you know the AC is greater than BC. If not, then when they say they can no longer hear a sound here, they will never hear the sound for air conduction. That lets you know that BC, your bone conduction, is greater than air conduction. So in this case, if bone conduction is greater than air conduction, that's a conductive hearing loss as well, okay? So just to hit it from the top and hit some bullet points really quickly, Weber, strike the tuning fork in the forehead. We're shrugging our shoulder like the emojis. Which side do you hear the sound? Does it lateralize on either side? It should not. It should be heard equally. That's a normal finding. If it does lateralize, you want to pay attention to which ear, because then that lets us know our next step. So you go based upon their affected ear versus their unaffected. So this patient that we were talking about in our example had hearing loss in the right ear. So if it lateralizes to the right, that's conductive hearing loss. If it lateralizes to the unaffected, being the left, that's sensory neural hearing loss. And then back to the Rinne test, you do mastoid bone first, then air conduction in front of the ear, okay? AC should be greater than BC. That's a normal finding. But if after they can no longer hear the sound on the bone for bone conduction and they don't hear anything at air conduction, that means the BC is greater than AC, and that is conductive hearing loss, okay? We'll go a little bit deeper into those areas on another video, but meet me back here, share with a friend, colleague, or somebody that you think may find it helpful. Talk with y'all later. Bye, y'all. Bye.